Hello, and welcome to the Albright Scholar for April 2021. My name is John Pankratz. I teach history at Albright, and each month it's my privilege to welcome BCTV viewers and residents of Greater Reading to take a glimpse inside our learning community up here on North 13th Street, to look at the work being done by teachers and students, and to think about its impact on all of us. Well, it's April, and it's spring-like, and those white flakes in the sky are not snowflakes, but beautiful blossoms from our flowering trees here in Berks County. The second part of our spring semester is in full swing, and classes are going on, and we are trying to keep our campus safe. Last month, in March, we talked about Albright's response to the coronavirus pandemic. And one of my guests on that occasion was Irene Langren. And I promised to her that we would have another show in which she and her colleagues and students had an opportunity to talk about a major, co-major at Albright in public health that's been around now for about 4 years, that was very carefully put together and is so current and so relevant to the circumstances that we find ourselves in today. So Irene Langren, professor of political science, is back with me today. My dear colleague, Hilary Aquino, Dr. Hilary Aquino, professor in the history department of political science and public health. And then their student, a senior, Victoria Baumert, who is co-majoring in public health as well. Welcome to all three of you.
Thank you.
Thank you. Thank you for having us.
It's great. We were talking just a little bit before we went on air about the genesis of this program. I know Hilary and Irene, public health has been an interest of yours really throughout your academic and professional careers.
Yeah, I think what happened was really, if you go back even to 2013, 2014, a few of us started getting together on campus and looking at public health as an academic program. And one of the things we discovered was that there was a wealth of expertise on campus in various departments. So we worked to pull together a team to work on this program. We brought in a lot of outside individuals for consultations. We held a lot of meetings with partners and potential partners to really craft and design an academic program that would meet student needs in public health in the framework of a liberal arts education.
Mm-hmm. Now, Hilary, you're a historian of medicine, and you've for a long time, you've been teaching a social history of American medicine, as well as courses in women's history and Native American history at Albright. And you've probably taught a lot of our pre-med students as well, who've signed up for that class as one of their humanities courses. So it must be really exciting for you to bring your historical perspective to this whole major and this field of study.
Yes, so public health, I think, works very well in a liberal arts context because it's so very interdisciplinary. It's an applied field,
It is.
but it really requires an understanding of various aspects of things that all of us teach about in all of our courses. We'll talk in a little bit about the course Professor Langren and I are teaching about pandemics, but it requires an understanding of statistics, of sociology, of psychology, of various types of bench sciences for people who want to go, communications.
And miscommunication.
Yes, yes. So I was really excited when we started talking about implementing a co-major. It's a co-major and minor right now at Albright. And my own personal training, I'm a historian of medicine and public health, and I've been researching the history of public health in an urban context for the past 10 years or so. So it's great to be able to use my experience in teaching the students in an applied field by looking at the humanities, right? Because I'm really in the medical humanities.
Right. Right. Well, I think the program is a real model of the way in which academic disciplines and programs grow at Albright. It's not plunked down and imposed from the outside. There's a real organic growth, and the fact that you as a historian of medicine and Irene as an expert in international relations, but with that public health angle. And then the other colleagues that you've managed to bring in. Victoria, when you, 4 long years ago, when you came here as a freshman, did you know you were going to co-major in public health?
I did not. I did not even know Albright had a public health program. But I originally came in as an IR political science co-major. I wanted to work within government systems, see how they function and stuff like that. And then it dawned on me after a visit to the ELCDC that I wanted to focus primarily on like health in those government systems and like how governments succeed and fail in incorporating health into their communities and like the people they oversee. So no, I didn't suspect myself to adopt that co-major coming in, but since I have, it's definitely been a great experience taking classes from all those disciplines and exposing myself to the possibilities the field has to offer.
Right. Well, if you were doing international relations, you were already thinking in a global and interdisciplinary way. So it just makes so much sense. Every disease vector is an international citizen, right? They don't stay put. So in order to understand them, we have to be thinking in that very wide way as well. Victoria, tell us some of the specific courses you've taken within this co-major.
Well, I've taken the necessary public health courses. So there's an introduction course. I've taken a course in epidemiology, which I actually plan on pursuing in the master's program at Penn State. So epidemiology I've taken the senior seminar on global health. I'm currently in the pandemics course that Drs. Langren and Aquino are offering. And I've also taken courses from outside the major. I've taken health psychology. I've taken the history of US medicine. I've taken a lot of policy courses with Dr. Amato. I took a few of his courses as well. And I even taken I have a Spanish co-major, so I tried to introduce myself to the global context there for the Spanish speaking world. So I've definitely been in most of Albright's academic buildings, taking a variety of the courses outside of the public health major itself.
Right. And it must be pretty fulfilling to think that all of these courses, both in the major, but also gen ed requirements, reinforce each other, that they're connected, that one helps to make sense of the others.
It is truly remarkable. For the past 4 years, I've definitely seen those connections developing. Like there are concepts that I learned in like my English, like Latin American poetry course that I've seen resurface in like the history of US medicine and stuff like that. Like it transcends just the confines of like one major, which I think truly encompasses the heart of the liberal arts education. It was really, really cool to see the past 4 years, everything come together and to come to fruition at the end of it all.
Yeah, and that's wonderful. And it's wonderful to be able to promise that to freshmen coming in, that there is that kind of coherence and interrelatedness. I know I've been acquainted with a number of students over the years who've ended up in public health as their vocation and as a graduate field. And they've had some wonderful and important careers, but they didn't know that public health was their thing until they graduated. But this way people will have kind of a running head start, I guess. Well, we've alluded to the course on pandemics. When did that idea come to you, Hillary and Irene, and what are the elements that you've included in it?
Well, it started out as just a general idea saying, look, we have to have a course that focuses on either this pandemic or pandemics in general. It's so important to try to understand the impact of the current pandemic, to try to make sense of it, and to try to apply, to help students apply what they've been learning in all their other classes to this really important transformational, in many ways, event. So Hillary can talk a little bit about her approach, which really talks about the lessons that we've learned from previous pandemics. And then what I'll be focusing on is really the work of futurists in terms of trying to look at different scenarios, trying to imagine what the world will be like, how it may change as a result of this pandemic, but also how we want it to change, right? To think very consciously and deliberately about the role that this plays. And this is also a synthesis course. So it's interdisciplinary as a course by nature. As we've said already, public health is interdisciplinary. So what we're doing is we're really challenging students to take their own fields of study and to apply them to how we study and understand pandemics.
So it really is a wonderful roundtable where students have their own expertise already, since many of them are juniors and seniors, but they're bringing that to this subject.
Absolutely. And in
Right.
synthesis courses, I always learn so much from students. In fact, in all my courses, I always learn from my students, but especially those who come from other fields.
Mhm, mhm.
They bring a perspective and a knowledge that I don't have inherently in terms of my training. So it's just fantastic to have all these students come together in this classroom setting.
Yeah. Hillary, how many students are taking the class?
I think we have 22.
Okay, so that's a nice big class
Yes.
and multiple different majors.
Yes, yes.
Yeah, yeah.
Yeah, so my part of the course, I'm kind of doing the first part of the course. So I try to set the historical framework. That's what we're doing this week. Looking at different perspectives from various historians. We'll be discussing at 3:30 this afternoon.
Yes.
So I took for an example, Charles Rosenberg's seminal 1989 article, What is an Epidemic? AIDS in Historical Context. So we're sort of looking at that, the way that epidemics unfold in sort of they have a very specific sort of narrative arc that they all follow. And then other
No matter what the organism happens to be. Yeah.
and what other historians have added to that. So taking into account theories relating to post-colonialism, disability studies. So what these various fields have contributed to a sort of the Rosenberg idea and built upon that to have it be more holistic approach. Then we're going to be looking at ways in which inequality has been framed from different perspectives. And then because it's a condensed course, since we're in the 7-week mode still, the two historical examples I'll be talking about are yellow fever and the 1918 influenza pandemic. And if we teach this again in a full semester course, I'll be adding back in the other ones, which were modern plague and AIDS.
Yeah. And those two examples are certainly global pandemics, but they also hit Pennsylvania really hard. So there's a local dimension to those. Oh, great. Are you reading whole book length treatments of yellow fever, article literature or chapters?
I've assigned a couple of scholarly articles, but I'm also using, so this is sort of the other side of this, is I'm asking students to think about being historical actors, right? 100 years from now, we're going to be reading their thoughts about surviving a pandemic.
Or not.
So, it's sort of, it's hard for me to wrap my head around living through a pandemic, being a historian of medicine, teaching about past pandemics. And so what they've read for today are things that were written in spring of 2020 by various historians about their perspectives, and some of them speculate, although, historians don't like to predict the future, but say, well, we may end up with this perspective as we have in past, but I don't know, because historians don't predict the future. So
Right. We don't predict the future, but we're rarely surprised when the future hits us. Right? I mean, Hillary, you weren't surprised that there was a coronavirus pandemic.
No, and part of what we hope students learn in this class and in other courses that are part of the public health program is we need to prepare for the next one, because there will be a next one, probably in the not too distant future. So again, taking the lessons learned from past pandemics and this pandemic and moving forward.
Yeah.
So two of those things. Local health departments, right? Berks County doesn't have one. I live in Lancaster.
Have one.
We don't have one either. So this would be a good time to push for, right? We need citizens as well as local politicians to push for establishing those and to highlight the importance of how it could have been more helpful if we had that infrastructure in place when this pandemic began.
Yeah, I didn't mind driving over to York County, but it didn't. That wasn't the way I was vaccinated against polio back in the 1950s.
And you also have the ability to drive to York County. Not everybody has a car, right?
And I know how to play with the internet. So,
Yes.
yeah, no, I'm privileged and lucky. Victoria, has your learning and study in this field influenced your experience of living through a global pandemic? I mean, I think we like to think that a liberal education helps us to live richer, more interesting, a more balanced, perhaps, life. Has it had an effect on you?
It's certainly enlightened me to kind of be more aware of like my surroundings in terms of living through a global pandemic. I know it was mentioned earlier that like sociology is a big part of public health. So I have been taking the time to like see how people react to certain policies in place and the big difference between like people that are encouraging their peers to be safe versus the individuals that are like, oh, this is all nonsense and stuff like that. So it certainly has made me more aware. And in terms, I don't want to say it's made me more scared of the future of like this society going through another global pandemic. It certainly has made me curious to see how it'll end up. But I certainly, without that liberal arts education, I just kind of be like coasting through it, like, oh, like I'm just gonna go about my day, wear my mask, all that. But allowing, like having that perspective allows me to kind of engage with my environment. Like, oh, like, why do you think this versus like, why do you think this? And hopefully we can collaborate and create those like institutions that provide access for everyone to get vaccinated. Like I'm seeing people struggling to get vaccine appointments and like for their grandmother. And then like, I'm just seeing people that are like, oh, I'm not getting vaccinated. So it's very interesting to see the divide that I don't think I would have recognized outwardly without like that indulgence in like my public health courses and even the corresponding courses from the other disciplines as well.
Historically, this pandemic has been remarkable because of the rapidity with which therapies and then also vaccines have been developed. It's absolutely remarkable. I happened to see 60 Minutes last night, and the head of DERPA, which is a defense department initiative, is trying to figure out a way as new viruses emerge to have a vaccine response within 60 days of the emergence of a new vaccine. That's a high-tech response to pandemics. Are you that optimistic? He was really hopeful.
I think, I think it's amazing when you look at the advances in science and technology, even in our response to this pandemic. We've been able to have a lot of successes, but then sometimes the most effective mitigation efforts are not high tech. They don't require a lot of research and development. And I think that's where we could be doing better. And I think that's certainly true in this country. If you look at the United States has been hit particularly hard by this pandemic, yet we're the most powerful country in the world, right?
And there's an
So-
awful lot of collective intelligence here. There's
Correct.
plenty of knowledge, but
Yeah. And I, when this pandemic was just starting, I had a nice conversation with another colleague in the humanities, and we were talking about what might happen. Will we come back after spring break? What is it going to look like? And I said one of the things that I was really concerned about is we haven't learned the lessons from the past. So I became interested in this field when I was working at another institution. And I was working on HIV/AIDS education then, and this was the 90s. And I was also volunteering for my local AIDS organization. And I started to look at missed opportunities that were happening by governments.
Mhm.
And that led me to go on to graduate school and to eventually study health systems. But some of the most basic lessons in terms of promoting the message of wearing a mask, it's not high tech,
it's not.
and it's so important. So I think there are also some very low tech, inexpensive, cost effective solutions to this that we really need to make the most of.
Right. I think once you understand the way in which viruses or bacteria are transmitted, then you just interrupt those. You don't drink polluted water. You don't breathe on strangers or have them breathe on you. Maintain those kinds of separations so that the disease cannot spread. But yeah, I'm not sure that that we have learned lessons from the past or all the lessons that were actually taught in school. But I think we at least need to get to the point where those lessons are taught in a way that's heard, in a way that's understood, in a way that's believed. Because I think we could be safer, and I think this current pandemic would have had less impact if we'd simply been as wise as we could be.
Well, one of the things we hope is very clear from even when the students read our course goals for this class is that the pandemic didn't create inequality, right? All it did was shine a light on inequity in society, and people who work in these fields like Irene and I know all about it. And now sort of the rest of the population is hearing about it. But if you live in a multi-generational apartment in New York City and you're all essential workers, you cannot, right? You can't quarantine.
Right.
It's physically impossible. So we also have to look at the ways in which what we're asking people to do is not possible for large segments of the population. So then how do we address those issues in a low tech way? And that's not even talking about the global issue, right? Of distribution of vaccines, right? We're doing fairly well in terms of vaccinating our population. Europe is not,
Yeah.
right? Europe is not. And to the developing world, right? So there are lots of issues of inequity that we'll touch on some of them in our course.
And you'll see those in the past, right?
Yes.
The best
Yes.
response to the yellow fever pandemic of the 1790s was to build a beautiful mansion 15 miles away from Philadelphia and just live there with your family.
Yes. or to escape the summers in New Orleans, right?
Hey, talk about inequity. Yeah, exactly. I think that's right. And that's where the interdisciplinarity of this field comes in, that it's not simply a question of disease vectors, but it's a question of human societies in all of its complexities, class structure, racial structure, and they've all been laid bare over the past year. Yeah. Are there, Victoria, are there other fellow students who are majoring in public health or who are taking the pandemic course that you know and have been in touch with?
I am familiar with some of the students because similarly, like we're higher level public health students and we've taken like the seminars together and stuff like that. Unfortunately, I haven't had the chance to collaborate that much outside of the classroom, just being like off campus and stuff like that. But I definitely have looked into their work through the discussion forums and the excerpts of their writing that they have shared with me. But it's also interesting because there's a lot of people that I haven't seen from the public health field in the pandemics course, whether they be like child and family studies majors or like from the sciences. It's certainly interesting. And I know Doctors Langren and Aquino mentioned this earlier, to get those different perspectives from those students. So I'm excited to get those in the pandemics course. But I am familiar with some of my fellow public health students, and I've enjoyed going through their work over the past semester. So I'm excited to see what they bring to this course as well.
Yeah, and I'm sure that this is the kind of course where students are deeply motivated to learn and to do well. Now, Victoria, you said that you're heading off to grad school. How has that process gone?
I am. I was recently accepted to the Penn State College of Medicine's Master of Public Health program. With that, it's a pretty, with public health, there's a general program that like you submit all your info to, like your resume, basic information, and it allows you to apply to multiple public health programs at once, which is certainly very convenient. SOFIS is what I went through. And then with that, I've been in touch with the faculty. They've reached out to me regarding my senior seminar paper that I submitted as a writing sample. So that definitely helped a lot. But yeah, I actually signed up for classes this week. So I get to dive into that. And then once August rolls around, they're hoping to do in-person courses. But it's a 2-year program. My first semester, I kind of get a taste of public health in and of itself is like, even without the other disciplines, is a huge field. You have global health, epidemiology, biostats. I'm going into the latter program, but unless I change my mind, I don't know, like I did with Albright. But yeah, I've recently been accepted to that and I'm excited to see where it takes me. I'm already dreaming about the doctorate program and like my dissertation and stuff like that, but haven't gotten that far yet. But it's been a pretty straightforward process and had a lot of help along the way. So
that's great.
Appreciate it.
If you want to take 2 years off, the Peace Corps is also a hands-on way to discover an awful lot of the way that the world actually lives and the health challenges that people face. So, well, great. You know, we are just about at the end of our time here, but this is such an important topic. I'm so proud that my colleagues and students at Albright have risen to this challenge and are doing such fundamentally good work, and that students in the future will be taking these classes and moving on in a wise and informed way to, you know, work on the challenges ahead. Irene, Hillary, Victoria, thank you so much for being with us.
Thank you.
Thank you, John.
Thank you.
And viewers, thank you for being with us as well. We'll see you again in May on another edition of The Albright Scholar. So long.
Bye.